Welcome back. Prescription opioids can be an effective form of pain management, but there are other options that can be used with or instead of opioids. Dr. Alyssa Abentroth, a general surgeon, joins us now, and thank you so much for being here this morning.
You're welcome.
So let's just start out with a general topic, and Lisa touched on this a little bit before the break, but what makes it so difficult to treat pain?
Well, pain is just such a complex symptom to treat. You know, there's the physical aspect, there's the psychological aspect, and even an emotional aspect. So as you can imagine, if I operated on 10 people, same exact operation, everybody perceives pain differently, and so all 10 of those people could have a different level of pain. And treating acute pain is a lot different than treating chronic pain. Acute pain is just that. It's pain that we usually cause, and if treated correctly, it goes away. But if it's treated incorrectly, it can lead to chronic pain, which can be weeks, months, or even a lifelong problem for the patient. Very complicated to treat. Obviously, one size does not fit all. You know, I wish there was just one recipe for every patient.
Would you say that opioids have definitely been our go-to when it comes to treating pain?
Yeah, you know, 20 years ago when pain became the fifth vital sign, you know, the main goal was how can we stop this pain in these patients? And so opioids at the time were thought to be the best method. We didn't know the addictive properties of opioids at the time. We were told as clinicians that using them in the clinical setting, they didn't have quite that addictive property. And we also didn't know just how poorly they work in the chronic pain population. Today we know obviously the risks of opioids, even the fatal consequences, and so we understand now that those risks definitely outweigh some of these potential benefits in opioids.
Okay, so how are we shifting now? Would you say opioids are still the go-to?
No, you know, there's been some because patient care, patient safety is our main concern, there's a great deal of national guidelines that recommend that we use non-opioid medications as well as even non-pharmaceutical methods to treat chronic pain. Even in the acute setting, there's amazing protocols that have been set up in treating acute pain without the use of opioids. So definitely a trend towards getting away from opioids and using other modalities.
Okay, so awesome. Let's talk about some of those other options. What are they? I
mean, one is just a very simple one, is just using non-opioid pain medications that we've all used for years. These include things like Tylenol, acetaminophen, ibuprofen, aspirin. Even some of the antidepressants have some pain-relieving symptoms for chronic pain patients. Other simple things that I use a lot in my practice would be creams, ointments, even lidoderm patches, which is basically a patch that you put right on the painful area to help numb it during those painful periods. Some clinicians are injecting the painful areas with anti-inflammatories or steroids. These are lasting weeks, even months, giving the patient some relief. There's also complementary medicine modalities. As I talked about before, there's a psychological and emotional aspect to pain, and so using things such as mindful meditation, yoga, stretching, cognitive behavioral therapy, these modalities have really worked well for these patients in this patient population. And then something that I loved and to be passionate about is just overall health. And so that includes diet, exercise, and weight loss. And as you can imagine, all three of those really work well for pain, especially when you're eliminating inflammatory foods in a patient's population. It really leads to less pain in those patients.
Well, that's great. It sounds like there are a lot of different options out there. Are there more high-tech ones that doctors are using now?
Yeah, there's some definitely really fascinating ones in the world of medicine. Some we know the science behind them, and some we don't really understand them, but we know that they're safe and we use them. We're using radio frequency ablation, so that's basically high-energy ablation or burning of the nerves that cause the pain pathway to stop that circuit from going over and over in that patient. We're using direct injections into the nerve. Again, these aren't long-standing. The patient would have to come back and repeat those injections. They're using electrical stimulation where they put a pad and it stimulates the painful area. Again, unsure of exactly how it works, but causes kind of a different sensation for the patient instead of pain. They're even putting pacemaker-like devices in the lower back that go directly into the spinal cord. It's called a spinal cord stimulator. It's kind of a last end resort, but it actually replaces the pain pathway with a more pleasant pathway for the patient, such as tingling. So when they feel pain, they push a button, and then the stimulator gives them a kind of a tingly sensation, so it avoids that pain pathway.
Amazing. Are there times when opioids are appropriate, either with those other options or by themselves?
You know, there still is a role. We use, obviously, opioid in the cancer patient population, end of life, palliative care, but also in the acute pain setting, we are using opioids. You know, we just want to remind our patients to use the lowest possible dose for the shortest amount of time, use them as prescribed. So there definitely is a role, but again, you're going to want to complement those with those other modalities that I talked about.
Okay, what about those patients who have been using opioids for a while? What's your advice for those folks?
You know, those patients are hard. You know, some of those patients don't want to give up their opioids, so that makes it a difficult patient population. But the ones that do, you also have to have really great communication with those patients and a great plan for those patients, because you don't want them to just to stop cold turkey. There's a lot of withdrawal symptoms that can be very devastating for the patient. So you want to have a plan where you're replacing those other medications or other lifestyle changes in with the tapering of those opioid medications. But really good communication with your provider and coming up with a plan that's literally going to be good for the both of you.
Good advice. Okay, one last question, I think. What advice would you give for patients in general to be engaged in their pain management or their pain care?
I really think, just like what I just touched about, is really letting your provider know your goals, what pain means to you and what your goals are with your lifestyle. And I think it's just that really nice balance of patients' expectations and how to alleviate the pain with the lowest dose of pain medication as possible, because on the practitioners or the prescriber side, we want to be as safe as possible. So effective for the patient, safe for the provider, to eliminate that pain.
Perfect. Thank you so much. That's all the time we have, but I appreciate you being here, Dr. Aventroth.
Thanks.
Coming up next, improving the way opioids are prescribed can help make sure patients get safer, more effective treatment for their pain. We'll take a look at new guidelines for opioid prescriptions and pain management. Don't go away. We'll be right back.